27 years old female with a history of infertility. I have focused the transverse section of the pelvic region. You are seeing the uterus with central endometrial canal in very early proliferative phase. It's surrounded by fluid with septas. You see, these thin linear echogenic structures are all septas in the pelvic cavity. And when I move the probe longitudinally, here you will see the uterus along with multiple septated cystic area. These linear thread-like structures are all septas. This is the uterus in longitudinal section, and in transverse section it measures approximately 2.5 centimeter, which is within normal, keeping in view that she is this is a case of infertility. This is the endometrial canal. This is the longitudinal view of the uterus in this patient. Now, this cystic area that I am saying, this fluid or cystic area, as whatever, so far is has echoes. You see low-level floating echoes with flapping septa. This is a complete thick septa, and it is flapping. You can see the movement of the echoes. Now this is a bunch of septa seen in within this fluid-filled cystic area, and it does not. There is no evidence of any blood being. I don't see any blood within the septa. Whether no septa contains any blood, otherwise the situation would have been aggressive one. So lucky enough she is not to have septations, blood within this septated area, multi-septated area in the dependent region. Now this is a huge cyst. It extends up to the epigastric region. Now here I am in the epigastric region, and you can see all septa, longitudinal section at the, you can see the aorta. This is the aorta. This is the cystic area. All cysts, XY, thin, thick, all type of septas, along with debris. Now I am in the right side of the abdomen. You will see fluid with echoes. You see, fluid with echoes. Now on the left side, so it is expanding on both sides of the midline, extending from the pelvic cavity. This is the pelvic region, up to the epigastric region, and then expanding on both sides of the midline with septa, with debris, no blood flow within this debris, within this multi-septated area, consistent. Now this finding is consistent with Mucinous Cystadenoma, and here I show you the magnified view. And in this magnified view, you can see this is a mass sort of giving a mass of a picture. However, this is not a mass. These are all gathered together septa, you see, within this cystic area. So this is our case of the day. Thank you very much.